migraines, arthritis, back pain, asthma, carpal tunnel, sinus, TMJ, allergies, whiplash. Do any of these sound familiar? What type of condition do you suffer from?
Before I came to the chiropractor, I had been to a few doctors. I had suffered a herniated disc between C6 and C7, and a neurologist was recommending fusion if I did not feel any relief in the pain and things did not progress over the next few months of when they were going to start physical therapy.
Before seeing the chiropractor, I used to suffer from migraine headaches, and I've always had poor posture, and that's sort of what led me to chiropractic care.
It was very hard to get around, to move. I had a lot of movement problems before I saw the chiropractor.
Well, my leg would hurt. I thought it was all like something wrong with my leg before chiropractic care, and it was actually my back, I found out. It would go across my back and down my right leg and into my foot, and sometimes my leg would go out from underneath me when I was walking or standing.
I had headaches and I had acid reflux.
Because my headaches were horrible.
I couldn't stand, I couldn't sit. I had done something, tweaked my back somehow.
I would be up all night with stuffy noses, or when I would take my medication before I went to bed, it would bother my stomach, and I'd be up all night. I wasn't able to breathe, wasn't able to sleep, and I'd get sinus infections constantly.
Before seeing the chiropractor, I had chronic, constant back pain. I had had in 1988 a total left hip replacement, which was not successful, and I've had problems with that ever since. And I've had neck pain and shoulder pain, and mostly from arthritis. Osteoarthritis is my major complaint.
I was in terrible pain. I had something wrong with my hip and my back, and I couldn't do anything about it. I went to a medical doctor. They said maybe arthritis, gave you some medicine. Nothing helped.
I've been suffering from my feet for such a long time, maybe 35 years, for suffering from my feet, day and night. Pain, very uncomfortable for me.
I used to have headaches, and my lower back used to hurt me a lot.
How bad does your pain get?
I was in intense pain. My head was really, I had to keep my head on my shoulder to try to experience any type of relief in the pain.
Sometimes my leg would go out from underneath me when I was walking or standing.
Before, I used to go to bed at night. Before the morning would come, I would have such a bad headache.
I would get up, I would go to work, and I remember it was 10:10 every day. I would get this massive headache, and I would just lean back in my chair and put my neck against the chair really hard, and then I'd have to get up and I'd leave, I'd go home, I would take a nap, I'd wake up from my nap, I'd walk around, I'd have to go back to sleep for a couple more minutes. Then I could get up and go back to work, and by the time I got home they were back again. At times they would make me nauseous. I just couldn't function at all. There were days when I just spent inside in complete darkness because I couldn't do anything.
My son had to bring me in the back of a SUV. I walked into the doctor's office and immediately laid down on the floor.
How does the pain restrict your normal activities or your lifestyle?
My son, he was 2.5 when he was diagnosed with chronic asthma, and he has allergies to dogs and cats. And when he got around animals, he would sniffle, and we didn't know what it was. We were like, well, he didn't have a cold before, and he was coughing, and I mean, just a horrible cough. And it got so bad, and he couldn't eat or sleep or talk. We couldn't even say a sentence. It was terrible.
I had a lot of trouble working because I was limping.
All I was worried about when it actually first happened, I saw myself in traction, I saw hospital stay, and that's, I thought when I was going to the chiropractor, they were going to take me from there, and I was probably going to wind up in the emergency room somewhere.
I used to wake up in the morning
and my heart would be racing. I'd feel like I was always in a hurry to go somewhere, worrying about everything. And during the day, I'd be taking something to just keep me leveled out, just so that nobody else would see, you know, what I was going through.
They had me on anti-anxiety, muscle relaxers, migraine medicine, you name it, they had me on it. And I went to the doctor, and they said my next step after this would be pain management.
And I thought that I was going to not walk anymore.
With your present treatment, is the pain getting better, staying the same, or getting worse?
I used to get a lot of headaches from my tension, you know, and ever since I've been coming to the chiropractor, it just totally released all my tension.
The pain disappeared. No more pain. No more. I could sleep very good because no pain at all. My feet is cured.
The results from seeing a chiropractor for a number of years now, on a once-a-month basis, unless I have an emergency, is that I'm actually healthier, even though I'm getting older and older and there are things wrong. It's been things that become wrong with you get better quicker if you go to the chiropractor.
I can get through the day without the tremendous chronic pain. I am no longer on pain medications. I was on Bufferin for 43 years.
It's just made me able to do more things, play with my grandkids, enjoy life a little bit better. It's a better quality of life, in my opinion. The fact that I go on a regular basis to my chiropractor.
Since I started the care, the results have been very good. I started out barely even being able to lift my head off my shoulder, being in intense pain, and began foremost having relief of pain, starting to have greater movement. Over the course of a couple of months, getting to the point where I actually was believing that I might be able to recover from something like this and be active again. It's been about 1.5 years now, and now I don't have to really worry about being limited in my activities, in my movements, even in my job function.
Since I came here, I have had excellent results. I have no more pain at all. I can move. I can move my back. I can do a lot more things than I used to be able to do.
I think I'm just, overall, just a healthier person. I just have, I feel better. I feel confident that what's being done by my chiropractor is making me a healthier person.
I don't have the problems with my leg. I'm not dragging my leg anymore. I don't have numbness in my foot anymore or my leg.
Chiropractic care has helped me so that I can continue to do my job and to earn a living for my family.
Results from chiropractic care have been the reduction of those migraine headaches. It was almost immediate. And also, I have a lot more energy now than I did before. There are times when I would feel a little bit sluggish or just like sort of like maybe a cold or something coming on. And the first person I call now is the chiropractor, and when I come up here and have an adjustment done, usually within a couple of hours, I'm feeling much better.
Everybody here is warm and friendly, and it's just nice. And if you ask them a question, they spend time, answer your question, and tell you what's going on in your body and why things are happening.
I haven't felt this good in 5 years. It's just amazing what it has done for me.
And I tell everybody, and I tell them all about my experience and how they should have themselves checked. A lot of people have the same problems I had.
It's a fun, relaxing experience. It's nothing to be worried about. It's not something that you have to fear in any way, shape, or form. I always look forward to going because I know when I leave I'm going to have that, good feeling. And the people at my chiropractor's office are just excellent. They have always been top-notch in taking care of me.
When it came to making appointments, they were very accommodating to me. You know, they helped me out and gave me the appointment that I needed to get here.
When I come to the office for my chiropractic workup and evaluation, I am treated as though I were a person, not a patient, not someone coming for an appointment, but someone who is important to the chiropractor and his staff. His staff, the staff of the clinic is wonderful, very caring, very, very interested, not just you know, summarily interested. They're interested in my well-being and in my life.